is mean corpuscular hemoglobin concentration. That is the one we call MCHC. Alright? This mean corpuscular hemoglobin concentration, should I say, is the most important in estimation of anemia and the detection of the type of anemia an individual is suffering from. Now, the mean corpuscular hemoglobin concentration talks about the concentration of hemoglobin in a single red blood cell. That is, it works in relationship with the volume of hemoglobin amount of RBC, or a particular amount of red blood cell. Now, it is measured, the MCHC now, our mean corpuscular hemoglobin concentration, is measured in percentage. Percentage now. Alright? This is the symbol for the percent with a normal number of 30%. Okay, now this normal value is between 28 to 30%. These are your normal values for mean corpuscular hemoglobin concentration. Now, mean corpuscular hemoglobin concentration now is normal when it falls within this range of 30%. Alright? And when it falls within this range of 30% or 28% to 30%, when we say that it is normal, we call it normochromic. That is when it is on the normal range. Alright? But when it reduces or when there is a decrease in the hemoglobin concentration now, or in the mean corpuscular hemoglobin concentration, we say that RBC or red blood cell now is hypochromic. Alright? Normochromic when the mean corpuscular hemoglobin concentration is normal in a single red blood cell, and the hypochromic when it decreases in a single red blood cell. Okay? Now, in our clinicals, which is pernicious or megaloblastic anemia now. Okay, this is your clinicals now. We say that MCHC now is macrocytic regarding the weight of mean corpuscular volume. Macrocytic and normochromic. It is either macrocytic and normochromic, or we say that it is macrocytic and hypochromic. Let's add it here, okay? Hypochromic. Okay, this is in pernicious or megaloblastic anemia. Then in iron deficiency anemia now, iron deficiency anemia, okay? Iron deficiency anemia. Now we say that the mean corpuscular hemoglobin concentration, MCHC now, is microcytic as regard to a low decrease or to a decrease in our mean corpuscular volume. Okay, microcytic and hypochromic. Okay, please, I don't want you to be confused in any way. I want you to note these parameters and how they are noted. Okay, good. Now, this mean corpuscular hemoglobin concentration now doesn't have or it's not hyperchromic. So this is hyperchromic. Okay, it is not hyperchromic. Why? Because the amount of volume of hemoglobin concentration cannot increase above its limit level in RBC. So it's either it falls within the normal range or it decreases. Right? That is why we say it is either normochromic or hypochromic. It is not hyperchromic, because most students confuse this in their exams, clinicals and otherwise. So please bear in mind. Now let's look at that, what the list. But before that, mean corpuscular hemoglobin concentration measures in percentage with a normal value of 30%. Now it's range 28% to 30%. It is normochromic when it is normal. Hypochromic when there is a reduction in the mean corpuscular hemoglobin of a particular red blood cell. Alright? Cool. Now, in pernicious or megaloblastic anemia, that is not clinicals, the mean corpuscular hemoglobin concentration is macrocytic and normochromic, or macrocytic and hypochromic. In iron deficiency anemia, that is a reduction or a decrease. Alright, in mean corpuscular hemoglobin concentration, we say that the mean corpuscular hemoglobin concentration now is macrocytic and hypochromic. This is all about the mean corpuscular hemoglobin concentration. Now,